We're going to give you 4 tips and facts on facial masks. How do they work and how do we use them? So point number 1, how do masks work? Viruses don't travel alone out of our secretions, meaning out of our mouth and nasal secretions. Viruses travel in what we call large droplets. And the way masks help with preventing coronavirus transmission is by keeping those droplets from traveling when you cover your face with a facial mask. Either a cloth mask or what we call a surgical mask that we distribute here in the hospital will do. The key thing about masks is they only work when we all wear them. We have proven this in healthcare settings. In this hospital and other hospitals, nurses and doctors are wearing their masks, and by doing that, they're really protecting themselves, but more importantly, protecting each other. We have shown through this pandemic that those organizations that have adopted universal masking have kept the transmission of the virus inside the healthcare setting at a very, very low level, much lower than the community setting. We all have to wear our masks. That's how we protect each other. Number 2, how do we take care of our masks? It's very important that you remember to try not to touch the front of your mask through the course of the day, because you're not going to be wearing them all the time. You'll be removing them on and off when you're eating, etc. Hold them from the back, from the threads, and make sure throughout the day, before you remove or you put your mask back on, wash your hands. Keep your hand sanitizer with you. It's a good habit these days with this coronavirus pandemic to cleanse your hands multiple times through the day anyways, and most importantly, around the time that you're putting the mask on or removing the mask. If you are using a cloth mask, make sure that you laundry wash it every day. A lot of times after a few uses, that laundry mask becomes a little bit loose and it's time to change it to something else. 3, which mask do you go for? Really, either one is fine. If you go for a cloth mask, make sure it's one that has more than one layer. Studies have shown that 2 or 3 layers are effective in keeping the coronavirus and other viruses from transmitting in those large droplets. I can't stress enough, whichever mask you choose, make sure that you're covering your nose, because secretions not only travel from our mouth, but also from our nasal cavities. So cover your nose and your mouth. Find a mask that fits well on you. Take care of your hands, wash your hands, and make sure that you're always not touching the front of your mask and pulling or putting your mask on with the threads. Last point, we all are going through abnormal times right now. None of us thought that at a point in their life they would be wearing a mask every day. Of course, we healthcare givers, especially surgeons and nurses that work in the OR, they do that for a living. They're professionals. They know how to keep masks on for long periods of time. But the rest of us, we're not used to that. So it's normal and totally natural for you to say, I'm not used to this. I feel like I can't breathe. This is irritating my skin a little bit. All that is okay to say, but we got to remember we're all trying to protect each other. It's a sacrifice to try to get used to the mask, but what we've heard from people who have really just stuck with it, that they get used to the mask after a few days of wearing it. And the last question: why are we encouraging you and really asking you to put the mask on even when you're on your own with your beloved one in the room? For a simple reason. We appreciate you visiting your loved one. We want you to continue to do that. It's so important for our patients' outcome that they're surrounded by their caregiver and family during the time that they're in the hospital. That's a very vulnerable time for all of us who get hospitalized. So we appreciate you for doing that. But remember, when a patient gets admitted to the hospital, they're sick and they're more vulnerable to infections. Their immune system is fighting other things, so they're more prone to the virus. So remember that when you're visiting your father, your mother, your husband, your friend in the patient's room, put the mask on to protect them. When you're up and around in the community, and now that coronavirus is more spread than a few months ago, you might be coming back and being a vector for the virus without even knowing it, and you might never develop any symptoms. But you could be transmitting that to other people around you, and most importantly, your loved one in the hospital. So please keep the mask on when you're with them in the room. Keep the mask on to protect them. Keep the mask on in the community, when you go to the store, when you have to go to places, to prevent you from being a vector for the disease without knowing it. And if we all do this, I think we're going to be in a much better place in a few months. And for our hospitalized patients, if we all do this, we would all be doing the best we can to protect them and make sure that they get the best outcome as they transition from the hospital back to home. Thank you.